a setting that's not shelter with services, and then hopefully a permanent setting. So with that, I'm going to introduce our panelists, and I will be the IT person too, so bear with me. So first, I would just introduce JoAnne Page.
So, hi. I'm a housing addict with a 20-year habit. I've been at Fortune Society for 33 years. We're a 55-year-old organization that sees about 9,000 people each year. When the pandemic started, I would have said that 25% were homeless and another hefty percent were inadequately or dangerously housed. Now I think it's probably about 30% and rising. We kind of backed into housing. We're not a housing agency, but what we found was this urgent need, and it was an unmet need. And we figured if we blundered in our ability to learn how to do this kind of housing, we couldn't do worse than what people were facing. So that's our castle. It's 140th Street in Riverside. That was when we bought it. It didn't have windows. It had a homeless person living on the 3rd floor. It had crack vials crunching underfoot. It had a serious drug dealing industry in the empty lot behind it. And when we bought it, our neighbors were more scared of us than the drug dealing that was going on in the backyard. And that's the staff, with me in the forefront, 20 years younger, and my dog. But what we did was we purchased the building in the right point in the real estate market in 1998. We opened it in 2002. It was a Catholic girls' school. The city had taken it by eminent domain and made it, were planning on making it into a TB hospital. And the epidemic waned, and they left it for 20 years. And we got it at the right time in the real estate market. We evolved our program based on need. And what we realized was that for people who came to us with violent convictions, there were no options, that they were excluded off the top from any decent housing opportunities that were available. So what we did was we had no charge exclusions. We can't deal with the people who have lifetime registration requirements because of sex offenses. We care terribly about that omission. And if we could locate a property, that's a terribly unmet need and a brutal unfairness to people who may pose no risk whatsoever to the community. But what we found, and we evolved this program model, is a service-rich model that allows people who are in crisis and have nothing to find a safe landing place, sort out what their needs are, stabilize, get crisis intervention, and move on to the next step. And I visualize transitional housing as a train switching station where people end up on the line that they need in order to move out. That it may be reunification with family. It may be getting a good job and being able to afford market rate housing. It may be a need to go into residential drug treatment. And it may, for a minority of our folks, be a need for permanent supportive housing. What we find, though, is that people who come out of incarceration are excluded from permanent supportive housing almost entirely because they're not chronically homeless. And almost all people coming out of jail are excluded, and all people coming out of state prison are excluded. And so we are an advocacy and a service organization. We have been advocating to have funding streams not requiring chronic homelessness. And we've also been fighting against landlord discrimination against people with records, which prevent people from access to the limited amount of affordable housing in our city and in our state. And we have sponsored a fair chance for housing legislation that would keep landlords from discriminating based on record. We lost because of real estate business agitation against it, and we're fighting to have it passed this year. We also have engaged in litigation, and we won a major settlement against a landlord that was doing blanket discrimination against people with records. And we have, I think we've got a case teed up. We work with pro bono lawyers in Washington, and they are a hell of a good firm. And we are the plaintiff because our mission is frustrated because of discrimination against our folks. And they are the lawyers. And it's kind of a marriage made from heaven. Our model is about not having charge exclusions, except for that two that we're limited to. Lifetime exclusion based on sex offense, and methamphetamine manufacture on public housing properties, and we've never hit a case of that. Okay, but what we have evolved is a model that's service-rich. It is supportive housing. It is about stabilizing people as they come in with warrants, with no income, with no documentation, with trauma, and stabilizing them and moving them on, and then realizing that once may not be enough. And we've evolved a system of prioritizing people for our scarce beds who have come through our housing, because we make a lifetime commitment to people. And people with lifetime issues, like long-term addiction, like mental health, like the trauma of incarceration, it's not one and done for many people. And often it's the second time or the third time through that people need. The majority of our staff are people who are formerly incarcerated themselves, many of them graduates. And what we've had is, based on the overwhelming need and the idea that we're offering a drop in the bucket to meet the need, is that we've expanded our housing from emergency and transitional to permanent. At any time this year, we are housing 400 people who are formerly homeless and formerly incarcerated, plus affordable people. And we just did a ribbon cutting on 57 units of senior housing, permanent supportive. And we've just purchased an illegal hotel and expect to have 59 people move in about a year and a half. So it's an unlimited need, but we're trying to expand. What we find, though, is that if people are stabilized in transitional housing, it's awfully hard to move them out, given the absence of alternatives. And we're filling a drop in the bucket by providing our own permanent supportive housing, but we're also advocating, because the discrimination is rampant, including by New York City, because of the requirement of chronic homelessness. We have been asked by New York State to do a replication of our housing model in Syracuse. It opened just before the pandemic, and it's going really well. And we are providing technical assistance to people who want to create this kind of housing. And what we do is we use our castle as a laboratory, and we walk them through. And they start by saying, this feels safe, this feels beautiful, this feels like something we want, but you gotta have an exclusion for people with violent convictions. and we say, you know that elderly gentleman who escorted you through the house? He just did 30 years on a homicide, and he's one of our anchor tenants because the stereotype is brutal. And a senior who did massive time for homicide is going to be the most low risk and invested tenant that you can get. And we use those leadership people as anchor tenants in our buildings. So I will turn it over to my...
Before we do that, I do want to expand on what JoAnne is referring to around the homeless chronicity, just in case folks don't know. So for New York City 1515, they've adopted the rule that HUD follows, right, which is you have to be chronically homeless for 2 years out of 4 years, kind of complicated. But one of the big pieces is that if you're institutionalized in a setting for over 90 days, your homeless clock kind of restarts. And we know that the average length of stay is about 255 days for people in Rikers, and even longer for people under the grad age law. But just also wanted to say that that is a policy decision. So there is no funding involved. So it's, you know, there's opportunities there, and hopefully we can talk about what that looks like later. Kristen?
Hey. Hi, everyone. Can you hear me okay? Okay. Oh, thanks. So I'm going to talk with you a little bit about one of the projects that I oversee at HousingPlus called SHERO. And SHERO is an acronym. It stands for Supporting Women and Gender Expansive People through Housing, Economic Mobility, Recovery, and Opportunities. This is a newer name for us. We just renamed ourselves recently. You may have heard of us before as the Women's Community Justice Project. We're still the same folks, same organizations involved. But we made the decision to change our name because we were getting confused with other amazing sister advocacy organizations with similar acronyms that kind of came from the same history. So just a little bit about SHERO. So we're funded by the Mayor's Office of Criminal Justice. We've been a demonstration project since about 2016, and we are about to finally, hopefully, in July, have a more permanent contract with MOCJ. We're a consortium of 4 housing providers. That will soon be 5, plus a healthcare provider, which we're really excited about. And so the 4 organizations right now who are currently involved are HousingPlus, Providence House, Green Hope Services for Women, and Our Children. And HousingPlus, where I work, we not only provide some of the transitional housing units, we also provide like the administrative oversight of the consortium. And we provide some shared resources that work across all of the units that we host. Across all the organizations together, we have 59 units of housing, transitional housing, 10 of which are for families. And I'll describe that in a second because the way we define families, I think, is really flexible and very helpful for who we're working with. And the initiative really grew out of a convening of my executive director, Rita Zimmer, and many other advocates and other organizations who began to meet to talk about ways in which women could be better served, women who were being detained on Rosie's, or women who could potentially even just be diverted and not have to go in. Sorry, I said Rosie's. That's the Rose M. Singer Center, which is the women's facility on Rikers Island. And so part of the effort, what grew out of it is an amazing advocacy organization called WCJA, and they're doing a lot of work. Kandra's on the board and was a founding member, I guess, right? Yes. So they're doing a lot of amazing work with a campaign called Beyond Rosie's, where they are really advocating to shut down the Rose M. Singer Center and create a smaller, more humane facility that's more centrally located. And so we have similar roots, like our initiative kind of grew out of that work as well. And so we're very connected to that. And so we are very much in line with wanting to obviously do that and decarcerate as many women and transgender or gender nonconforming folks as possible so that they do not have to remain detained on Rikers and at Rosie's. So I mentioned the 49 single units and the 10 family units. The 10 family units that we have are relatively new. We added them in 2020, and the idea was like the majority of the women that we're serving are mothers, right? They come to us and we call them singles because they're in single units, but so many of them before having to go to jail were caregivers and their moms, and they were separated from their children, and or they come to us pregnant, and so we were able to convince the city to give us a bit more additional funding and have these 10 flexible units where it could be like a mom who's in the process of reunifying or just doing visits, like they have enough space where they can actually prove to ACS that they can actually reunite, or space for mom who's coming to us who's pregnant for the first time and is going to have a baby when they're with us. So I just wanted to mention that because those are really essential units, and it's something we learned over time just through engaging with the folks that have been staying in our single units. So we do a lot of like the same kinds of on-site supports as supportive housing projects, really, except we're transitional, right? So we have on-site social workers, case management, peer support, 24-hour staff, and then like each of the 4 organizations that's involved has kind of a different flavor of what they offer, right? And so, which I think really helps, just being able to offer varied resources for such a varied, population of people. They have different needs. So Green Hope, for example, they offer, their units are residential treatment units, right? Our Children is more focused on employment programming. HousingPlus is more of the organizations that's focused on like housing first and harm reduction. So you get the idea. And so we like that varied approach, and we're going to continue to do that as we expand. The hope is sometime in this new fiscal year, we're going to be able to grow and have a total of 140 units, which is really exciting. We work really closely with ATI providers, it's alternative to incarceration, supervised release, public defenders, and other folks who support people while they're detained, and that's usually how we get referrals to us. And then all our participants, I mentioned the shared resources that are on my team. So all of our participants have housing specialists that work on the sort of main admin team that go to the different sites and talk with each of the people that are living in our transitional housing to help figure out a more permanent housing solution for them. And as JoAnne alluded to, it's just extremely difficult to do that. What else? So I think the other thing I just wanted to mention is just, all of our locations are trauma informed and we use gender responsive approaches. We are really focused on serving women and trans and gender nonconforming folks. So we're recognizing that we have to address unique needs, right? For the group that we're serving, and so, for example, like doing things around focusing on promoting healthy relationships, recognizing that people have caretaker responsibilities, just even the physical environment that we set things up, right? Because really everybody that we serve has experienced some significant trauma in their lives, right? So like making sure that the space feels safe and doesn't feel institutional and like feels like a home. Just a snapshot of who we serve. So about 40% of the folks that we serve are survivors of domestic violence. There is a fact sheet that might be going around that's about criminalized survivors, and I thought that was, do you have that? Or is that, it's okay. Anyway, so the Mayor's Office to End Gender-Based Violence had created it with a group, a committee, a criminalized survivor committee, and I thought it was a really good fact sheet to just describe many of the women who we're serving, because they are involved, they end up involved in the criminal legal system because they are defending themselves or trying to, to get out of an abusive situation. So many of the people that we serve actually have very serious charges, but more often than not, it is related to them being survivors. Like I said, a lot of our folks are primary caregivers before they end up in jail, so about 53% were primary caregivers of children before they ended up in jail, and now they're separated, right? So that's a big focus for us. About 60% experience serious mental illness, and then about a third are in recovery, and about a fifth are actively using. So just back to the challenges piece. You know, I think like JoAnne said, the access to supportive housing, especially for the people that we serve, has been extremely difficult, especially because of the chronic homeless definition. I think also just like just the stigma, frankly, that is associated with people who are justice involved. And so I think, you know, just even matched up next to other people that may not be justice involved that are in CAPS, our folks unfortunately just have less of a chance of accessing many of the supportive housing units. So for all of you who are supportive housing providers, I would really urge you to talk with your staff and maybe find ways to increase the ways in which you can serve the folks who are impacted by the criminal legal system. I think another piece I just wanted to mention is just like the lack of funding to appropriately staff this project, right? And so like, I'm sure you may have heard that the city spends about $560,000 a year on somebody, on one person on Rikers. They are paying us $50,000 a year for one person in our transitional. And we have to pay rent, right, which is ridiculous. You know how bad the real estate is around here. And so that's crazy, right? And so like finding ways in which we can continue to push the city, right, and recognize that the DOC budget should absolutely not be increased right now. It should be decreased, and more money should be put into housing. And then I think another piece is figuring out ways in which, you know, I talked about the flavors of our different providers, but like finding ways to balance the ways in which we can create more flexible programming. So I have dreams of creating more like a safe haven style for some of our sites. For those of you that are familiar with like street outreach work, right? So much lower demand, lower threshold. But being able to balance that with others' expectations of what a quote program should be, right? And like being able to like figure out ways around arguing with a judge or a DA that like this isn't programmy enough. When that might be the one thing that like gets them actually released. I think I'm gonna stop there. I said a lot. Thank you.
Good afternoon, everyone. My name is Kendra Clarke. I'm the Vice President of Policy and Strategy with Exodus Transitional Community. And before I get into Exodus, you know, just a little personal history of mine. I'm formerly incarcerated. I spent about 10 years cycling in and out of incarceration, homelessness, and addiction as a young person. I've been incarcerated in Chicago, in rural America, and then also on Rosie's and at Rikers. I spent 4 months there before going upstate. And when I came home from prison, I actually got an internship with the Fortune Society and started my career there. And I remember, and I remember how hard it was to get housing, right? It took me 5 years. I was working full-time, going to school full-time, and couch surfing for about 5 years before I finally could afford my own studio. So housing is very personal to me. I see all of us struggle with housing, and unfortunately, the discrimination never ends. I'm an executive now and have a master's degree and sit on a bunch of commissions, and I still get discriminated for housing. And it doesn't stop with renting. When you try to own a house, it follows you. So definitely, advocacy is a huge part of what we do. So with the Exodus, Julio Medina is the founder and executive director. He spent 12 years inside prison before coming home. And our entire mission about Exodus is really serving folks who are justice impacted and hiring folks who are justice impacted. So we have about 300 staff. 80% of us are directly impacted by incarceration. And that includes over half of the executive team, over 75% of the directors and above, right? So it's even at the top leadership, we're very cognizant of that. And we also are a trauma responsive agency from the top down, which has definitely been a lot of work. We're still in years of training because it never ends, right? And I think sometimes folks think you just do a training and you're trauma responsive. This has taken like years for all the policies even of the agency to be trauma responsive, right? And we provide wraparound support, mental health, substance use, workforce development, education. We have a trauma center that does non-traditional and traditional forms of therapy, including music therapy. We have a music studio, so kids can come use our studio instead of being on the street committing crime to pay for studio time, right? So really just trying to think outside of the box and meet folks where they're at. You can go to the next slide. So at the height of COVID, the city reached out to us and a few other providers to see if we would be willing to open reentry hotels. And that was because folks that were getting released at a rapid pace at the height of COVID, they couldn't put them in the shelter system because didn't allow for social distancing, right? So I think initially the concept was kind of just to have us warehouse folks, and that's not what we do or who we are. So we kind of went back and forth with the city and said, okay, we will do this, but it's on these, you know, we have to have these things in order to do that, and that's 24/7 staff on site. We have case-ex, we have housing specialists, we have job developers, we have case managers, residential aides. Really meeting people where they're at and providing them that safe space, that was really important to us. And so we started with 1 hotel, now we're up to 6. Yeah, we have over 800 residents, and you know, moving them to permanent housing and even other forms of transitional housing has been definitely difficult, and I'll get into some of the challenges that we've experienced, but it's similar to what JoAnne and Kristen both said. Next one. So, you know, cumulative outcomes, some of them that are just important is, you know, we've served over 2,000 people in the program, providing them with case management and really meeting them where they're at. And for a lot of folks that come home, like they'll say that we're the first people that have actually talked to them like they're human beings in years sometimes, right? I have guys that have done 30+ years, folks that have been doing 1 misdemeanor at a time on Rikers for a life, right? We have been really good about helping folks get employed. So we currently have 468 people out of about 830 employed, which is a really, you know, something that's very important to us. And we also employ a lot of folks at the hotels as well and other places that are coming home. And for permanent and stable housing, we've moved 239 folks so far. We have about 241 that are still in the pipeline. And again, the process has been so challenging because a lot of city bureaucracy. Our hotels are funded through the mayor's office and they are not funded through DHS. So DHS will not allow them to be qualified for vouchers, right? They're not counted as homeless according to DHS because they're not in their system. So it's very eye-opening to kind of see all the bureaucracy and the monopoly that's kind of going on with when it comes to housing and why so many of our transitional housing sites are excluded from all of these things. And then I think another really important one is 434 folks have been linked to mental health or substance use treatment in the community. And we do have a lower rearrest rate than DHS as well, right? And I think that's really, really important to note over these last 2 years. You can go to the next slide. So challenges. Again, it was about 4 months of advocacy just to get the CAP system, the Coordinated Assessment and Placement System, and I always credit Corporation for Supportive Housing for helping me with that. Because, you know, we knew we had folks that qualified, yet we did not have access to even have them apply. So again, it was months of that, being able to finally get it. There's still obviously a lack of units, and folks are discriminated against for units because if they have a violent history or even just any history period, we often see discrimination. Another one is just vouchers in general. I feel like we take 1 step forward with vouchers and it's like 10 more steps back. We finally got FEPS, you know, up to fair market rent rate, and I felt like for a minute during COVID, landlords were kind of letting folks in because they didn't really have any other option. Now it's right back to how it was before COVID. You have a voucher? No, we don't want you, right? Even with the increase. So it's yes. Yes, so it's definitely been a nightmare to kind of learn the process and try to figure out ways around it, and then also try to advocate for new policies to make sure that we don't have to keep dealing with this. And then I think just overall, discrimination. JoAnne spoke about fair chance for housing. It's something that we've been on the campaign for years as well. Very disappointed it didn't get passed last year, but we are really hopeful that it will get passed this year. The city council speaker in her inauguration was just on the 22nd, and she spoke about fair chance, she spoke about clean slate, and she also spoke about making the rule change in the city that would bypass the HUD definition of chronically homeless. So, I'm always letting folks know she spoke about this openly in her inauguration speech. We should all be advocating and calling our elected officials, calling the mayor and saying, hey, this is smart justice right here. Like, this is smart legislation. We need to get this passed. And then the last slide is really around resources. I'm always letting the city know we've kind of done the work for you, and we're giving you what we know as the experts and the blueprints, and it's just frustrating that they often don't follow through. So there's two big reports. One Patricia spoke about, which is the CSH report. And it talks about the amount of money that we could save the city, $1.2 billion, if we put folks in supportive housing versus Rikers. Like, let's think about that. Think about all we could do with that $1.2 billion. And we talk a lot about improving, JISH and some of the other JISH's justice involved supportive housing. It's actually through DOHMH. And, JoAnne can probably speak about this a lot better than I can, but the rates are so low, it's often nonprofits end up kind of losing money or having to come up with other sources to lean against in order to make it work. And JISH is like the most vulnerable population. These are the most frequent system users where we could really save our city, not just financially, but also safety, everything, right? If we would provide folks with housing. So, we're all advocating to get DOHMH to increase that. Sustaining the Mock J hotels. There's been a lot of backlash around the hotel program, and a lot of it is fear, right? I've dealt with a lot of NIMBYism and just a lot of hatred, and then also dealt with a lot of folks that we've been able to educate and help them kind of understand, right? The Mock J hotels were never originally designed to be open permanently, but what we have found, like, this has been crucial. I not only have over 800 people in the hotels, I have over 400 people on a waiting list to get in. I have 59 people who are registry impacted who have been held 3 years past their maximum expiration date in prison, right? Past their maximum expiration date. And there's hundreds more that are being held because they have nowhere to go. Right? So it's filled that gap also to allow people to transition and create stability before they get that supportive housing unit, right? We know there's like an 18-month wait list often for supportive housing units for folks that do actually qualify. So the Mock J hotels, it's crucial that they be sustained. And unfortunately, with the new administration, it's just been a lot of back and forth constantly, and them not really seeing the value in what it's brought. So that's something that's definitely a challenge because we're also getting very short contracts, and if they close, I have to worry about not only the 800 people of where I'm going to help them get housing at, but also 100+ staff that are going to get laid off that then I'm going to have to also worry about housing for them because then they're not going to be able to pay their rent, right? So it's very challenging as an executive team working with contracts that are on 90 days or 6-month basis, and you're kind of every day just praying and hoping that we get a little bit more of an extension, and then what are we going to do if we don't? And then for the Reinvestment Commission report, so I'm one of the, and JoAnne as well, we both sit on the Reinvestment Commission. It's the Closure of Rikers Island and Reinvestment Commission with the Speaker's Office. And again, we have really done a lot of cognizant work to identify areas, including health, housing, youth, employment, that we want to see investments in. And our job on this commission is to make sure that as the borough-based jail plan goes through, the cost savings that we get from closing Rikers gets reinvested in the communities who have been the most under-resourced and who need it the most. And then it goes into these specific areas, which is health, housing, employment, and youth. And again, in that report, it's very clear that permanent supportive housing is far more cost effective than custodial or institutional care. And again, remember what Kristen just said. DOC gets almost $600,000 a year to detain or incarcerate people, where we've just lost our 5th person this year on Rikers, 20 years old, and we lost 16 people last year. And as providers out here, we get paid $50,000 in bed, and we have to beg, borrow, and steal to like get that, right? Like it's just a constant conversation. So we're really trying to get the administration to fund solutions to scale and stop investing in systems of oppression and invest in communities so we can actually reduce, decarcerate and really fix our city. And that's it. Thank you. Me too.
There's so much to talk about, and I think, when we're talking about budgets, something I would say is not only fiscally makes sense,
Yes.
but like from a humanitarian and humanity and dignity, it makes even more sense, right? To house people in their dignity. So I have a few questions, and actually, Kandra, maybe I'll start with you since you just spoke about the Montje hotels that were really important during COVID. And there's a lot of people that refuse shelter, don't want to go to shelter, but they go into the Montje hotels, right?
Yeah.
Can you talk about why that's an important piece in the continuum to allow people to kind of thrive and get better and get connected?
Yeah. So most of the shelters, actually, the DHS shelters, actually don't have mental health or substance use services on site. In fact, I was just on a panel with some of them, and I was really astounded to see how few actually do. And often the shelters, it's much more dangerous. They're congregate settings. So that's very traumatizing. Like for me, I refused to go to a shelter. I was rather couch surfing even in a child's bedroom, like my girlfriend's kid's room. I rented out for a while, and I chose that over a shelter because, the shelters are just so dangerous. And so for our folks at the hotels, they have their own room. They have agency, they have privacy, right? We do wellness checks 3 times a day. We have security that's on site. We build relationships with folks. I think that's something that you don't see at the shelters. And again, it's us talking to them multiple times. Like JoAnne said, it might not be the first time that they're going to accept the help, but we're not giving up, right? And we're staying with them and really investing in them, and they're knowing that we're not going to give up and go away. And so at some point, they do then come and really get those services. So overall, it's just much safer. It's much cleaner. It's way more privacy. You actually get agency. And I think for being someone who spent time incarcerated, that's something they strip you of. Like you have no agency, you have no privacy. And it's almost like re-traumatizing to put someone back into a congregate setting in a shelter when they've just been released from prison, especially if they've done a long time. So overall, our folks are always saying they're not going back to the shelters, that if the hotels do close down and we're not able to get them permanent housing, that they would choose the street. And it's sad, but we see that all the time.
In the street, emergency room, or in jail?
Yeah.
Or detox. Detox, yeah. So, as a corporation for supportive housing, we always start supportive housing, and really think that there's a lot of people who could benefit from just going straight into supportive housing, not have to go through the shelter system. But we do know that some people do need it. And can you talk about, so before there was funding around transitional housing, but that has dissipated and has left providers not really able to really do that work, right? So can you talk a little bit about that?
So most people who come out of the criminal justice system and are homeless don't need permanent supportive housing. They're capable of living in the community, maybe with light supports that they access in time of need. Permanent supportive housing is limited and it's expensive. Transitional housing is an alternative that either can get people prepared for and into permanent supportive housing, or can get them into the community in a variety of ways. But the funding has virtually been eliminated from HUD. HUD used to fund transitional housing. We're just about the handful of only survivors in the local continuum of care that provide transitional housing. DHS is the only stable source of shelter funding. But there are, let's say there are difficulties, right? We are having a contract for 35 beds that has not come to pass for several years after we wanted to start it. We are not willing to have shelter-style security, and we had to negotiate because we don't want metal detectors, we don't want guards, we don't want limited visiting. We want people to have this as their transitional home and be able to build the ties. So the only funding out there is shelter system, except for this mock JRFP, which was delayed maybe a year or two? Two. Which has a 30-day cancellation clause, as our government contracts tend to have, which is currently in negotiation, which pays, we have a 100-bed contract that started July 1st, and we've not been paid a dime, and it's June, right, because of delayed contracting. And it's 3 years now for the contract that should begin July 1st, which won't begin with an executed contract. And if we're lucky, it'll be 6 months before we see a dime. And there are real estate costs. And it's renewable for 3 years, which means that this opportunity won't come by for another 6 years for other providers. And it's the best game in town. So it's penny wise and pound foolish to put people in shelters, which cost about $50,000 per bed, and to put people in Rikers Island at $500,000 for a hellish bed. And 50%, more than 50% of the people released from state prison to New York City are released directly to the shelters, where they sleep with their shoes under their heads and dodge people shooting up in the bathroom. And it is a legitimate choice to say, I prefer the street to shelters. So there's a dearth of funding for transitional housing, and we want good transitional housing, right? We don't want it as an intermission between periods of homelessness. And that requires tackling discrimination and tackling $215, which is the public assistance allowance for a single person for rent. And it's 10% of what it costs to have an apartment in New York City. And God help us, why are people homeless? How do people have the courage to fight the system and get housing under these horrific conditions?
Kristen, I have a question for you. So, not often we talk about women in justice space, and there's a lot of efforts around men. Can you talk about any specific needs for women? And if you're thinking about developing supportive housing in particular, is there some special considerations that we should make?
Yes. Good question. So I think I think a couple things. One, if you take away the access issue, just in general, having apartments that are more flexible in size, so that we can understand that it's a process of reunification, and so figuring out ways in which housing providers can move somebody perhaps from a smaller 1-bedroom to a 2-bedroom when they're able to get their kids back. I think that, or flexible space for home visits and things like that would be really helpful. Obviously, and this goes for everybody trying to access housing in general in New York City, but just less hoops. It's just ridiculous, right? And so with our families, they have so much going on, right? They're trying to take care of their children, get their kids back, do like, you know, go through all these other systems. And then, for example, we have access to the emergency housing vouchers, which has been great, although we haven't found an apartment for anybody yet. But like, just for that system, we have to use 5 different databases, right? Like, that's just a ridiculous amount of hoops and way too much paperwork to prove that somebody is worthy for a freaking voucher. And then like 1515, I'm hearing, the New York City 1515, I'm hearing there's like not enough families that qualify for that. I mean, that's a perfect example of like, let's figure out how to change that policy so more people can more families. There's like family units that are opening up and they can't actually fill them with families because they don't have enough 1515 approvals. So that's another piece. Just more resources in general to support the whole family at housing sites, right? Like recognizing that mom isn't the only client, but like ways in which you can take a more holistic approach and really support children, especially now. Just things are just, you know, it's extremely difficult coming out of the pandemic. A couple other things. One, we're going to add a family advocate position to our initiative, which like will hopefully, you know, and it'll be a shared resource across all of our sites that will help. I think there's not enough people that are like helping mom navigating the system to get the kids back, right? And really being able to understand what the family court matters are, right? And so we're going to try and fund a position to do that. And then I think the other piece that's been really helpful and we'd love to see more of, HousingPlus has some of the units, but more eSHI re-entry units, because those haven't required having to go through CAPS, and we've been able to directly refer people and families in particular to these eSHI re-entry units, and I would love to see more of those in the future, and I think that's a great way to provide supportive housing to families that have justice involvement.
Yeah, and a note on eSHI, as many of you probably know, it's new development. So there could be a lot of eSHI awards out there, but we're not going to see the actual apartment until like 5-6 years. So that's also a challenge. And I think someone asked a great question if eSHI can be used in current housing. So in apartments that are not supportive housing, but there is an apartment, like you can just use it for that. So I think that's a possibility.
Oh.
Yeah. No. They said no, actually.
They said no.
The city said no. Sorry, they said no.
Yeah, Otana said no. You know, eSHI is also permanent housing, and so it doesn't fulfill the need for funding for transitional housing. But transitional housing is a critical part of the continuum, and many people need transitional housing who can then go on and live their lives without the expensive permanent supportive housing. So it's kind of penny wise and pound foolish not to invest in transitional housing, but it's a bear because DHS really is the only source other than this mock RFP.
Can I just add to that? JoAnne, I totally agree. I think there should be more transitional housing, but I think that there could be less transitional housing if we removed some of these unnecessary barriers to accessing permanent housing for people. I think that there's a lot of people that we could move through our units much more quickly. So I think it's both. We need better access and some more transitional, but I think maybe over time, maybe less if people could access permanent more easily.
If the public assistance support for rent were not idiotic, okay, were not $215, it's a primary driver of homelessness. We raised that issue with Dan Teets from Otada in a prior meeting, and there may be some hope for a change, and that would be homelessness prevention and homelessness shortening, because if people could afford apartments at I don't know how I would get an apartment in New York City for $215. I think I could get a square foot, maybe a square foot to stand on, but no sleeping room. So that's a driver of homelessness, and we choose to spend $500,000
Exactly.
as an alternative to market level rent. So yes, people would not need transitional housing if they could afford stable housing that they were ready for. I think there always will be a need for transitional housing, because if you've done a bunch of time,
Yeah, I agree.
you need supports, and you need to know how to cook, and you need to know not to put metal in a microwave. So I think that there is a need for transitional housing, but we find that people stay in our transitional housing far, far longer than they need to or want to, simply because they can't afford to move out.
Yep.
And that locks up another bed that another homeless person could.
And I know you each operate supportive housing, and we know that there's some people, small subset, right? It's not everybody, as JoAnne said, that need that permanent supportive housing, because without that, they wouldn't really be able to maintain. And I know Exodus is starting to look into kind of supportive housing. Do you want to talk a little bit about that and some of your future plans?
Yeah. So, we're really excited. We see that the need is crazy, right? I have a prime example. I have I work with young folks as well. I run the Women and Girls Project. And so I'm always referring folks over to WCJ because I get a lot of young women who are escaping domestic violence and a lot who have some serious mental health concerns. And, a prime example, and I think it hurts me the most because this was one person that DHS gave a voucher to very easily. Well, I think it's because they just didn't want to deal with her, and they knew that, she would explode and just end up back in the system. And so she was misdiagnosed, and when I went up to see her, she was in a full psychotic break, and she was diagnosed with something that didn't even reflect that. So we ended up getting her to the hospital and getting her all these things. And, throughout that process, I just kept thinking, boy, she needs supportive housing. And now we've had to step in and make a relationship with the precinct. We had to put mental health tags on her door, on her wrist. We had to have conversations with her landlord because she really explodes, right? And she's a bigger girl. She's 19. But they will tase her, they will call the cops on her, they will beat her. They don't respond like how we respond. The police straight up told us, you all are doing God's work, because I would have tased her a long time ago, right? So if we're not there to actually be on site to intermediate those things, and this is someone who doesn't have supportive housing but is desperately in need of it, right? And so throughout this whole process of just seeing the need in so many different ways, Exodus has really decided to step up and take ownership of housing. So we're working with different funders to get the funding streams to do like the initial startup, which is identifying the sites and, doing the feasibility studies and getting the architects and really working with me on the finance piece, because that's something that I don't know, right? And we have reached out to Corporation for Supportive Housing, and we've done a series of trainings with them. We also get training and technical assistance through them. And right now we're working to hire a development consultant team to come in and, like I said, really help me with that first piece of identifying property. And we want to do, my goal is to open new housing every 4 years. So we want to do hotel conversions, we want to do ground up, and then we also are interested in looking at buildings that just need to be gutted and renovated, right? So we are open to everything. We are open to all communities. I would love to have one in Harlem since we have 7 offices there. In East Harlem, so I think that would be really phenomenal. But we're definitely taking, the advice of organizations such as Fortune Society, who have been leaders in this realm for so long, and, learning from past mistakes of other orgs and trying to get it right the first time, right, and make sure that we're doing the smartest decision, because this is like 30-year decisions for the agency, right? It's so long-term that I wanted to make sure that we were going in really prepared and that we have a full team. So it's been a really beautiful process and also a very strenuous process. When I first started, we had a developer that one of our staff had worked with previously, and it got to the point about 4 months in where I was like, I'm not doing this with you, because you care more about money than you care about the people, and that's not what we're here for. So that's when I kind of stepped back. I called, some folks over at Fortune, had some conversations with Cynthia over at Shinny, with Patricia over at Corporation for Supportive Housing, and I got a really nice list of developers who, you know, care, right? And who this is not just about the extra millions that they can get at the back end of it when all of us are out here struggling and we're just trying to house people. So it's definitely a risk and it's a little scary, but I'm always encouraging nonprofits to do this now that I've been through this as well, because we need more housing. And it's not just two organizations that are going to be able to fill the need. Like, we all need, especially for this population, we all need to kind of get out there and do our part across the board with housing.
And, you know, I would like to comment from 20 years of developing permanent supportive housing and transitional. We've done it 3 ways. We've done it with a co-developer, which is a plus in terms of sharing the guarantees, right, and lessening the risk, but a minus in terms of developer fees, which is the only way that you can kind of get unrestricted money in large quantities. We've done it with a consultant, which puts more risk on, but gives the developer fee much larger. And this last time, we did it with a joint venture with a for-profit, where we handle the permanent supportive units and they handle the affordable units. And that is a plus in the sense that it's no risk, but it also is very little developer fee. But I think those 3 methods are all valuable, and one can balance the ability to take risk and the learning curve and do it more safely. But I think that you want to concretely discuss and devote resources to addressing NIMBY proactively.
Yes.
When we purchased the castle, I said that people were more scared of us than the drug dealing that was going on in the backyard. And we made a commitment to the community that they would be safer because of us than they were without us. And we made a commitment that if they had any problem, they could just turn around and address our staff member at a meeting. And 20 years ago, we purchased that building. We go to 6 meetings a month in the community still. But what the payoff was that when we wanted to develop our empty backyard, we had a fight with the community around their desire to have apartments in it, rather than to try to keep us out. And we did mixed affordable and supportive housing, and we're a part of the community. And when we were granted the right to develop a piece of city-owned property at 123rd Street in East Harlem, the reputation preceded us. And we've just completed ULURP, which was a threatening process, without bulletproof armor and with full support, because they used our community board in West Harlem as a reference. And we now have purchased an illegal hotel on the Upper West Side where people were locked and loaded because of the Lucerne and so forth. And we're 20 meetings in with the neighborhood. Sherry Goldstein in the second row is our point person because she had the foresight to move into the neighborhood 35 years ago and pave the way. But we are hitting much less opposition because we are meeting with everybody and telegraphing who we are and what we do and not mincing words. But I think we've developed a playbook, and we have a toolkit on our website, fortunesociety.org. We call it Yes in Our Backyard, because it's about how to deal with NIMBY. And we found that the people who are most opposed to us tend to be our strongest supporters when we win their trust, because they're the most invested in the community. So I think that if you want to house people who carry the level of stigma that formerly incarcerated people handle and the level of unjustified stigma, you need to have a plan for NIMBY.
Yeah.
So I definitely want to open it up to discussion, but before we open it up to the audience, there's a lot of challenges, but I know that there's very concrete solutions, and we've all talked about what some of them are. But can you guys just say one thing that would be helpful in changing the system to allow more people with criminal legal backgrounds to access housing, whether that's supportive housing or just housing in general? I'll give you guys each one. That's it.
Advocacy to remove discrimination, both in supportive housing and affordable housing and market rate housing.
Yeah, and I think what JoAnne said about the $215, right? Like, finding a way to reduce that would help.
Less paperwork.
So does anybody, we have some time, I'd love to open it up to questions or discussions. Jordan?
So how can we utilize supportive housing and housing services to decarcerate and really make our city a less carceral place as we move on the spectrum towards abolition?
So we run alternative to incarceration programs, and often the pivotal thing that we can use to get a person out of jail or not into jail or released from parole, because we do what I call back-end ATI, where we advocate for people who are currently incarcerated who would normally be hit by the parole board, is the commitment that we will have a bed for this person at this day if you release him to us or her to us. So the ability to have housing is pivotal about getting people out.
And I got to add the reentry hotels. That's one of the prime things that we hear all the time from judges, is that they're not going to be released unless they have a hotel bed, and they're not willing to release them to DHS shelters. So it's literally, it's up to us to try to make room to find, a room for someone in order to actually get them off the island. And I get calls, we get probably 20 referrals a day sometimes from every defender organization. So it's a constant thing that the judges would be more willing to release folks if they had housing.
I would also add, I think it would be great if we could have people embedded on Rikers that are actually doing supportive housing and other kinds of housing applications. If we could have people doing that from there, and providers actually accepting of that and being able to interview while somebody is detained and being able to hold on to a bed for a certain period of time, I think that would be, that's what we do now, right? For our transitional, if we could find a way to do that for permanent, I think that would be a wonderful addition to decarcerating as many people as possible.
Yeah, and I think, the city has tried to attempt this through the Justice Law supportive housing, that with the idea that someone goes straight into supportive housing and bypasses the HRA 2010E, all those documents. Only 120 beds for the entire city, so it's not a lot. And there's lots of challenges in that program as well. But it's been a challenge to get people directly to supportive housing. And I was also talking to the people at DOC. They don't even know what CAPS is or what the application is. So if they're not, how can they effectively discharge plans? So we've been recently working with J, who started their reentry program and trying to get them trained up to learn about supportive housing in particular, and so they could do effective discharge planning.
And one thing to that, Brad H requirements, discharge. So Brad H is and you might be able to explain a little bit better. We'll explain.
Brad H happened when there was a tragedy of somebody mentally ill pushing somebody under a subway. And it is a requirement that people with a diagnosis of mental illness get services on their release from Rikers Island. And there is a miserably small take-up, and it's an ineffective system. but it's a mandate.
Yeah, and so they're mandated, so this stuff should be happening while it's inside. And just to give you a little statistics, 86% of the women inside qualify as Brad H, 54% of the men. So this is a large percentage of folks that are on Rikers. And, you know, from the perspective of being at the hotel, you know, I'll have folks, obviously they should have had a biopsychosocial and a psych eval done while they were inside, right, if they're Brad H. So you would think that we would be able to get that, so then when I'm at the hotel and I'm trying to do their 2010E, I don't have to now find a new doctor to get that for them that doesn't know them, right? So they've also been sitting inside Rikers for how long? How many times? The average length of stay is over 300 days. So those doctors are very familiar with them, especially if they've seen them a lot. So it's just, again, like, it's such a broken system, and the bureaucracy of it just makes it so complicated that it's like, it doesn't need to be this complicated. This stuff is already supposed to be happening by law inside. We should be able to easily access that information to then do our pieces on the outside with, you know, completing the CAPS application, and unfortunately that never happens. And you have, for the CAPS application, every 6 months it would have to be an updated biopsychosocial or psych eval. Insurance only pays for one a year. So I run into that issue all the time as well, where then I'm trying to find a new provider that's like, doesn't even know that this person just did it 7 months ago, because, you know, it's just a constant, like, the bureaucracy just makes it a nightmare where you're like running in circles.
I don't know about you, but there's not a lot of psychiatrists out there just willing to do a psych eval.
Yes.
For people that they don't know and are not in care. I know you had a question.
Yes, the HUD chronic requirement, why is it there? Is it because HUD finances some of the homeless money for New York City? Is there any, is
You
that?
mean for the 1515, why they're using the HUD requirement?
They use it for a number of things, but
Yeah.
is it really necessary, or they just decided to use it, or is it tied into federal funds that might ultimately?
There's no federal funds in 1515.
Yeah, you know, I was on the task force that was responsible for designing 1515, and I fought bitterly against the chronicity requirement because it precludes most of the most needy people. And I lost. But it is not required because HUD funding is not in the city funding. And the city, I think the rationale is that's a simple way of getting the highest need people identified. And it's also a way of identifying and removing the longer stayers in the shelter system.
But I've had experience where someone has been in for 4 years, but in and out, in and out, in and out, and they didn't qualify for
Right.
HUD chronic.
Yeah.
Exactly, because of the 90-day piece, right?
I
That's
mean, it's
also a big
ridiculous.
Right,
Yep,
it's ridiculous.
we agree.
A study was done of people who were eligible for JISH, which is people who are having the highest rate of shelter using and jail using and cost the city a mint. And only a tiny minority of them were eligible because they were not in any shelter long enough to build chronic homelessness.
Something that we started talking about is, can we just include prison and jail as part of homelessness, right? So just like if you're in a shelter or on the street, you're considered homeless. But also if you're in prison or in a jail, that's not a home, right?
Yep.
So how do we start shifting our thinking with that? You had a question?
I did. My name is Renee. I'm from Cases, Pretrial Services.
Hi. We love you.
We're a supervised release program. And like Kandra,
Yes.
I have lived experience. I'm a credible messenger for Cases. So about 17 years ago, I experienced street homelessness. I was 17 years old. And through that, got into a bunch of issues, wrong crowd, and I was incarcerated. And when I got out, when I went to court, the judge did the best thing he could have ever done for me. He mandated me to Cases. And 17 years later, here I am, working for Cases. Like yours, the work that we do, it hits home for me.
Yeah.
And I carry that with me every day to work, to help my participants. And so, issue I ran into recently while trying to help an individual was transitional housing. She's never housed on Rikers Island. She just kind of was in bookings for a little bit, went to arraignment, and got released to our program. Now, the organization, I don't remember the name, where I was trying to help her with housing, their requirement was that she had to have been released from Rikers within 6 months. I called a few other places, they all said the same thing. She didn't want to go into the shelter system. She'd just rather be on the street than go into the shelter, like a lot of you guys were saying. So my question is there a way or is there a plan in action to address when someone hasn't actually been on Rikers or was incarcerated, they're just got arrested, were released to supervised release, looking for housing, want to get into transitional housing, but doesn't meet that requirement? Or do you have any recommendations for where I could, call or how I can set that up?
You could
We
call
need
us.
that every day.
She's
like right
She
here.
would be eligible for mock J housing.
Yeah. And now, I don't know how long ago that was, or if I hope that wasn't the.
No.
I hope you never did that. But yeah, no, and with the new contract, it's going to be even more flexible, and we're going to be able to serve people who are coming from upstate, or that they're defining it pretty broadly for who we can serve under the new contract. But even right now, it sounds like she's somebody that could be referred to us. So I'll give you my information.
Well, we have men too.
Right.
Well, we do, man.
Yeah.
I'm getting everybody.
Yes.
I don't even have a card. I don't even. Sorry.
Good afternoon. Phenomenal job for all your organizations. Keep up the good work. We appreciate you. My question concerns any criteria surrounding transitional housing. Say if you have a residential house, you have a two-family house. Is there any square feet requirements, any number of bedrooms you have to have before
To operate transitional housing? Is that what you're asking? To operate transitional housing?
Yes.
Or?
Yes.
I think that the obstacle you're going to run is funding. And I think that if you want to do it, locating a funding source is imperative. The requirements of the shelter system are 6 feet between beds and a host of other things. But it's a bear to get funding from the shelter system and a multi-year process. The dearth of funding, if you,
Talk to JoAnne.
I think that there is no source other than the mock J one we've talked about, which is closed because the RFP was awarded, and the shelter system. And that's a hard truth.
And with the mock J one, it's only 1,000 beds. So, it's closed for 6 years, but it was only 1,000 beds that
Right.
they gave between the 6 providers. So,
Yeah.
Since we're a national organization, we learn about very cool things everywhere else. And Ohio has such an amazing program where the Department of Corrections allocates funding for housing. They don't manage it, they don't run it, they just give the money for people coming out, and then they have supportive housing providers there. And their definition of supportive housing is kind of similar to JoAnne's, where here's some services. It's not all this crazy eligibility that we've kind of dug ourselves into sometimes. But there's some great models out there, and one of CSH's goals is to really try to bring those to light. New York have done great things, but there are other things and other groups that are doing great work outside of New York. So
We are advocating for more transitional housing funding.
We are
And
too.
it's essential, and it's cost effective, and it's a decent human thing to do. So I think that advocacy is really important on this issue.
any other questions, comments? Yeah.
As a supportive housing provider, it's so frustrating how long it takes to build housing, right?
Yeah.
When we first opened, it's like, oh my gosh, we can house 50 families. Then you have to wait 6 more years for another. Does it take this long everywhere in the country? I mean, it just seems so ridiculous that it takes.
I don't think it takes this long everywhere. I just think there's a lot of complications, like a lot of kind of regulations between, the Department of Buildings, and other people can speak more around it, but it does take a long time. And I think, probably even just getting the site, it takes so much time because where are you going to find the site in New York that's open?
Yeah.
Right? So there's a lot of great policies out there that are
putting up a hotel that is going to cost half as much per unit as building from the ground up, and we're looking at 18 months.
Yeah.
Yeah, I mean, some projects take 6 years, 6,
Yeah.
7
I don't,
years.
it's all the ones we've.
Yeah, I treat 5 years as a norm for ground up. But there is the Honda legislation
Yes.
that is too restrictive
Yep.
and may be modified, and that would provide an opportunity. And one of the opportunities which I'm eyeing is Class B office buildings in Manhattan, because people are not returning to work in downtown Manhattan at 5 days a week.
That's key.
And I think that Class B will be the next opportunity.
Questions? No, sorry, you were just stretching. Huh?
Can you guys share stuff so people can sign up for the Fair Housing Advocacy Campaign?
Oh, for transfer housing, yeah. How?
It's Allison. If we just give them Allison's email.
Fortune's website.
Get involved with the campaign.
Yeah, and
Yeah.
it's really important, something we as Corporation for Supportive Housing are also involved with, even though there's a lot of misconceptions around what kind of background checks you have to do in supportive housing, and some providers do use that as a determination whether to accept people, and we know that that's not right. So it's really important for us to also get that passed so that people are able to enter supportive housing.
It's just fairchancehousing.org.
Yeah,
I
you
just
can.
want to give a shout out. I mean, I've worked with JoAnne and I used to work for the state, and I think it was huge when the state was able to change the fair housing rules in order to be more flexible. And now I get to work for a provider where we get to be more flexible, and we are more flexible at the Institute for Community Living, and we are taking people with criminal justice involvement because we're able to.
That's great.
So I think that's a huge piece of changing the rules so you're actually able to let people in who you would like to.
Yeah, and I think, we go back and forth whether there should be specific housing like JISH, right, specific housing for people impacted by the justice system, or can we just make all of our housing responsive to everybody, all right? So how do you make sure it's trauma informed? How do you make sure you have policies that don't decline people from housing because of their history? So it's a little bit of both.
You know, I think what you're talking about is an example of where advocacy was effective and has opened thousands of units to people with criminal justice history. When we first wanted to lease up our initial permanent supportive housing and affordable housing, we hired a company that was experienced in doing lotteries, and we found that they uniformly eliminated anybody with a criminal history and would let them appeal. And what we found was that was the practice in the field. And you know that people are not going to appeal. So they are effectively barred. And we brought that to the Governor's Reentry Council, and we succeeded in having the governor do an executive order barring blanket exclusion and requiring an individualized assessment for any affordable housing funded with state dollars. And that opened the doors for thousands of people. And when we received a communication that was very threatening, saying you cannot discriminate, we celebrated.
Yeah.
Any other questions or comments? Any final words from you all?
Just, this is very important, and it's very tough, and it's very life-changing, and it's very rewarding.
Yeah, no, I totally agree with that. And really just keep pushing the elected officials. Like, all of us have to do our role in really fighting for change. So I just hope everyone can invest in that.
And I do want to echo that. We've been doing a lot of work with City Council. My colleague Hassan